Would I benefit from upper and lower blepharoplasty? Can I have an estimate for how much it would cost? I was born with hooded eyes and my lower eyelids. You can see the red part of my eye. Would blepharoplasty correct those issues, and what would the estimated cost be?
Thank you for your question. You submitted a question with photos where you talk about having hooding over your eyes, as well as the appearance of your lower eyelids, which in the left eyelid appears to show the pink part of your eye. And you're asking about would blepharoplasty correct this and what the cost would be. Well, you have a unique situation where the anatomy of your eyes are something that you were born with, and enhancement has to be done very, very carefully. And let me explain. When you have the anatomy that you have, it appears like your eyes are very prominent. In some ways, it has some similarities to someone with thyroid eye disease or Graves' disease. Now, what that means is that when someone's eyes are very prominent, if you were to actually have a procedure like upper eyelid blepharoplasty, where you take away a lot of fat and a lot of skin, you can actually make the eyes look more prominent, or sometimes referred to as a bug-eyed look. So you have to be careful when it comes to the upper eyelids. I think the more complex issue has to do with your lower eyelids. Your lower eyelids are retracted. What lower eyelid retraction is basically the appearance of where the position of the lower eyelid would be if you were to look at everyone else, where the lower eyelid is at the level of the iris, and lid retraction means that it's lower than that. Now, a lot of people have that as a genetic trait, and it's normal and runs in their family. In your situation, it's fairly retracted to the point where you're actually seeing the pink part of your eye called the conjunctiva. And so there are different levels of procedures that you can consider in order to get the eyelid to appear the way you want. There could be something as straightforward as a lateral canthoplasty, or a lateral tarsal strip, where the eyelid may be reattached at a more internal aspect of your orbital rim or the bone. That might help get the eyelid to a position that's more symmetric with the other eye. Or if you want the eye to be more vertically high, then it gets more involved, and little procedures where the eyelid may be just pulled slightly typically don't work. Very often in someone like yourself, we actually have to do some kind of spacer graft, which is providing some vertical support of the lower eyelid in order to get that vertical height. So then it gets a lot more complex. So without going into all the details of all the possible procedures you can have, the other aspect of this is the physical examination. So when I examine someone and see how much elasticity they have, it also has an impact on what kind of recommendation I make about how to manage their lower eyelids. So at this point, meeting with a qualified and an experienced cosmetic surgeon, specifically one like an oculofacial plastic surgeon who has a lot of experience with lid retraction, is advisable. I think that if you choose to have a routine blepharoplasty performed for your lower eyelids, it is unlikely to deliver the types of results that would be ultimately the best results possible for you. You need to really think through what will make you happy. So with that in mind, I wish you the best of luck, and I thank you for your question.